Hi, Miriam. Welcome to the MR Runningpains podcast. I want to thank you for being here. How are you doing today?
Hey, I'm good. I'm good. Thanks for asking me to be here. I've been really excited about this.
I'm excited to have you on. Um, as I probably talked about in my intro, Miriam's a good friend and a longtime physical therapist for myself and my wife and my son and most of my friends, some of the athletes I coach. So we've had a long history together, and I trust her with my legs, my back, my my body. So thank you.
Thank
Um,
you.
so in these crazy times, you're sitting there in your office, so we have to assume that you are open for business.
I am. I'm open for business. I've changed my schedule a little bit. So I'm only in the office maybe 4 to 5 hours a day. I've been treating in a mask since it started. I guess fortunately and unfortunately, my dad had some immune issues, so I had some masks at the house. So it wasn't that hard to do, and got all the cleaning agents, and so very low traffic, seeing one-on-one, sanitizing between clients, those kinds of things. So really taking all the precautions that are recommended, and then started doing some telehealth, also offering some telehealth sessions to clients, and that's been actually doing great. I had done it on a very, very small level with some clients I had from out of state prior. And then recently it's been nice because I think it's triggered a lot of patients that are sitting at home just having some questions, but not enough to come in, but more wondering about, this or that about either running form or something they read about running or something about their program. And so it's been really nice because it's been a really easy and comfortable way to have a conversation with them while they're at home, and it's been fun. And I really actually didn't expect that. I was a little bit uncomfortable with it in the beginning, but it's really been great. So it's been good.
Is that through the phone, or do you do video conferencing?
I do video conferencing. Yeah, I use a program called DoxyMe. It's with healthcare providers. It's HIPAA compliant. And the wonderful thing too is when all this started, there were so many different educational courses and webinars about how to do this appropriately and make it easy. So I feel like a lot of groups were very generous in giving that information to healthcare providers about how to do this and do it quickly. So it's through DoxyMe. They make the appointment online. It's one of my appointment types, so they can just choose it. I send them a link through the email, and they just log on. And I just actually posted today about how to do that. And I had one of my favorite clients or experiences with that is I had a client here, but he's been living in Spain. Actually, I didn't realize that for the last year. I hadn't seen him for a while, and he booked a telehealth appointment. And so it was just so surreal to talk him through some of his rehab, but also, get his experience about how he was doing in Spain and how Spain was doing. And it was really amazing. It was really uplifting to talk to him and,
That's
kind of
really
reach
cool.
out. Yeah.
Yeah, that's all. I imagine you can also send some of the exercises that you might have them do through email and such that they can print out the pictures and the description of what to do.
Yeah, I sent them all the handouts of what we discussed after the session, so they have that. Mm-hmm.
That's very cool.
Yeah.
Let's jump back a second and let you kind of introduce yourself a little bit. What's your background? How'd you get into physical therapy? And then we'll continue from there.
So I graduated from PT school in 98, 99, something like that. So it's kind of funny that I've been treating a long time. When you were talking about treating your family, knowing you for a long time, it's been about 20 years that I've been treating. And when I went to PT school, it was kind of interesting because I really didn't know exactly what I wanted to do within physical therapy. I had initially thought I'd want to go to medical school. I'd taken the MCATs, and I just had this huge change of heart, like prior to applying to med schools. And so I decided to defer my scores for a little bit and do some soul seeking. And PT sounded like a nice avenue to kind of start with. And so in school, and physical therapy it's really neat. It's like a lot of other healthcare professions where you can delve into so many different realms: pediatrics and geriatrics and neuro. There's animal physical therapy. There's so many different genres of therapy. And so I kind of watch as my classmates, they all came into therapy school, PT school with, I think, something in mind. And I didn't really know. And I love learning about everything, but nothing really caught on as far as an interest for me until I started taking my biomechanics course. And I really love that. I had a great professor with that. I had another professor, his name was Walt Jenkins. And he taught me, I took a special topics course on foot and ankle mechanics. And how to glue and grind orthotics and do all these kind of different things. And I just fell in love with it. I just couldn't get enough of it. And so that's where I kind of found my niche. And I got the opportunities to observe enter in these different gait labs. I went to the Mayo Clinic in Minnesota and to the gait lab there. And I had some really wonderful experiences at UVA with Jay Sherry and Eric Magrum. And they had just an amazing setup there. And so when I came out of PT school, I had a kind of a unique situation. I just started a job in a sports medicine clinic. And if anyone knows Southeastern Rehabilitation, it's a huge physical therapy clinic now. But when I started, again, this is 20 years ago, and I came on and my employer there, it was just he and I were the only trained therapists, and he was really great because I came in and I was like, these are things that I do and I think I can offer clients. And so I immediately had like a little orthotics lab, and I could glue and grind orthotics and look at shoes. And I started the Gait Analysis lab because what I observed during school and in these different clinics, I thought was really important service for runners. And I had never seen anything like that before, but I knew if I spent enough time with somebody, and working at my fastest, still 2 hours was kind of the cap for that. But if I did a good clinical exam, a table exam, a video analysis, same day treatment, went over gait retraining and some different strategies, people really seemed to improve a lot quicker. And it also met a lot of runners' needs where, look, I've got this going on and I have to get back to this immediately. I don't want to stop running, and I have this event coming up, and it's a very normal response, I think, for most athletes. And so, Darren just let me do it. He's like, that's great. So I started the private runners clinic. I didn't know what a cash-based clinic was at that time, but I knew insurance would never pay for a 2-hour session. It just wasn't an option. So I got to start the 2-hour cash-based runners program there. It was called Ground Reactions at the time. And I also got to do a lot with foot and ankle rehabilitation. So, and that's kind of how I started with that. So it was really neat. Mm-hmm.
Yeah. Well, let's touch on each of those points a little bit later. But you're also a runner.
Yes.
You're running.
Yeah. It's funny. I was actually before I started, I was talking to a friend. It's funny how you have an idea of what you are, I think, as an athlete from when you were younger. So growing up, especially in high school, I was really into basketball. Like that's what I did. I played basketball. I really liked being an athlete. We played a bunch of different sports, but basketball was my favorite. And then, really what was drilled into us is if you're going to be better for your sport, you run, you lift, you play. That was just what you did and how you developed yourself. And I was not a great athlete. It was not like I was the best player on the team or anything like that. I was decent. It was fun. But I realized every morning I woke up, I ran. We had practice late after school. I loved going to the gym and lifting. And that was always part of my, mostly my daily routine. So I carried that with me through high school and college, the same thing, like to do a little bit of running, go to the gym, play some basketball with friends and things like that. And so really it wasn't until I moved to Asheville. I never participated in a race. I actually never even saw a race. So growing up, I don't know if they had races in Mississippi at the time. I don't remember that at all. I don't remember anyone running. I don't remember seeing anybody. I had, some family members that would do it, but yeah, it was just a whole different ball game. And I don't know if that was something nationally or just Mississippi was a little bit different than that. Did you grow up where there were a lot of races and things like that? Like when you were growing up?
We did, yeah. Where I grew up, it was a big deal. We had some really big names that came through our area, so it was like a kind of a historical area for running.
Yeah. So, and then when I moved here, it was it's like let's find a place to go running, and actually the trails were a lot more accessible here. So the Mounds of Sea Trail picks up behind our neighborhood. And that was the first time I ever had gone trail running ever. And I just loved it. I did. It was so refreshing, and I really enjoyed it. And I honestly couldn't tell you. I mean, I ran by myself for most of those years, and I probably didn't run a race. I probably didn't run a race until maybe a race to the Taps when they first started. Maybe I'm trying to think. I never really thought about it. So it probably was fairly recently I started running a race. And then I just picked up a couple events since then, did some 30Ks, did 2 50Ks. I was going to do a third for Fauna Flora, and then that got canceled. So hopefully when all this passes over, I can pick that back up again. Yeah.
That's the hope, right?
Mm-hmm.
So kind of diving more into the physical therapy world, what is your role as a physical therapist? How would you define that?
In general, the role of a physical therapist, I think if we're going to put it into technical terms, is dealing with the neuromusculoskeletal system. So dealing with nerves, muscles, tendons, bones, fascia. Okay, so it's a really large spectrum. And there's so many different techniques that people can apply and use, but really most clients come in when there's either pain in those realms, limitation as far as mobility, something limiting their activities of daily life is what we call it. So usually those are the things that bring people in, either a mobility issue, a pain issue, something limiting them with their goals that they need to meet daily. So that's kind of the broad spectrum of what a physical therapist does. And it can take me, again, there's so many different realms, like we talked about, like geriatrics, pediatrics, animal physical therapy, neuro. So it's really neat. But I think when most people think about going to a physical therapist, those are the issues that come up. You know, they're having knee pain. It's hard to go up and down the stairs. They threw their back out, lifting some wood. You know, for runners particularly, what I see, if that's the question that you're asking more, especially with the running population, obviously pain, injury is one of the reasons I see a lot of adults. Sometimes I see people when they're not, despite their training, they're not improving their performance. They feel like something is holding them back and they can't really put their finger on it. And they can't really put their finger on it, so they come in to see if there's anything physically limiting them with that. And a lot of times you can kind of figure that out, or if I need to route them to another healthcare provider for more systemic issues, we look at that. So I just need to charge that. And so that's why I see mainly in the adult population. Once in a while, and it's kind of funny because I did develop the program to be more of a preventative, you know. So but I would say that's probably the fewer of the cases I get. But I do get people that come in, they haven't been running for a while, or they've had a hiatus and they're running, they want to get back to it, and they don't want to become injured, and they're being proactive. And I love seeing people like that. Or novice runners, they've never run before, they want to do their first 5K, and those are really neat cases to work with. But they just want to make sure they want to have a full look at their system to see if anything is interfering with their ability to start this training or puts them more at risk to be injured. So that's another kind of category in the adult population that I see. I differentiate that a little bit, the adult population and younger runners, so middle school, high school runners, collegiate runners. Their issues are similar, but a lot of times we're looking more at like bone stress injuries and things like that with the younger runners. Times or coaches feel like there's something off with their running, but they can't really figure out what it is. So kind of sifting through that. So I definitely get that population also, which is really fun to work with.
Cool. Thank you. Talk about referring on to other medical professionals. Where does a physical therapist fall on the medical professional spectrum?
Yeah, and that's a great question. And it really actually differs state by state. So it can be a little bit confusing. So I don't really know every state's laws with physical therapy. In this state, in North Carolina, we have direct access. I know it's a question that people have a lot. Do I need referral for physical therapy? And in this state, you don't. You can go to your physical therapist and have direct access for treatment. On the spectrum, it's kind of funny. I think it depends, because sometimes I see people, I'm the first person they'll come to for anything. we have a good discussion. And if they need imaging, they need to have blood work done, that's a physician, if it's something systemic that we really want to rule out, I refer them to to a physician, their physician, or if they need a referral for something more specific, I help route them to that person. So that's kind of how it usually works. Or a physician will see a person and they feel like physical therapy services would behoove them. They have knee pain specific to running. They're doing something during their running that is aggravating their knee pain. Then they usually refer them for a biomechanical analysis. So it kind of works both ways. And we have some great physicians here that are locally that are just wonderful to work with. They're very easy and open to get patients to.
Cool. So how did you get into this, part of physical therapy in which you're doing the gait analysis? We kind of talked a little bit about it earlier where you got into the office with Darren, and started coming out with your perception of how to do this. But talk a little bit about what is the analysis. What do you do? When somebody comes to see you, what is the analysis? What do you do on the table? Flexibility, mobility. What are we actually doing?
Yeah. I feel like I was really lucky because when I first got out of school, UVA was starting to do a series of educational courses called the UVA Running Medicine Symposium. They would have that annually. It was Eric Magrum, Jay DeSherry, and they'd been allowing me to observe in their running lab for quite a while. So a lot of what I did as far as creating my lab was to mimic as much as I could what they were doing up there. Just brilliant people, really amazing, and they were getting great results. And their lab was actually designed. It was a multi-million-dollar lab. It was instrumented treadmill and 10-camera Bicon system, and it was meant for actually also doing research. So I was excited not only that I was working around or learning from really amazing clinicians. I mean, I can't say enough about them. And they still, to this day, have that running symposium if there's any healthcare professionals that are listening. But they were also doing the research to prove, are what we're seeing in the clinic and what we're treating, is it really working? Is it really valid? So coming away from that, the way that I set it up and the way that I still do it today, for the first hour, so I have a client come in, and I say this to every client, because I explain to them the process, and it's like, we're going to sit down, we're going to take a very accurate history. You're going to sit there and just tell me everything, and I do. I want to listen from the time that they remember being athletes as kids or anything else that was important during that time to the present day, and that looks at their history, their daily life, their work. So a pretty all-encompassing health history. It's very important, and kind of getting all that down. And I tell them, we're going to break up the first half of the session. We're going to do a clinical exam, so a table exam. So we look at their strength, their flexibility, their functional movement, a little bit of a core assessment. So this is called a table exam, and I kind of put them through a different, kind of a complete barrage of clinical tests to see what our treatment diagnosis may be. And some of the deficits they may be having within their system. I tell them that's internally what we're working with. Those are the internal forces, okay? And then we're going to go out and run on the treadmill. And this isn't a fatigue sample. I let them warm up a little bit and then take a couple minutes of video with a slow motion capture device. And I'll load it onto the laptop. And I said, we're going to review your running form, frame by frame, and look at the most meaningful moments in the gait cycle. You have the most forces pushed through your system. And those are the external movements that we're going to look at. So we're going to look at the internal movements, which are the table exam, the things we find in the table exam, and the external forces from the video. And they go through it with me. Okay, so they can see exactly what we're talking about. So about halfway through the session, it's about an hour in, we have a really strong hypothesis about the leading causes of what's feeding into their symptoms and or limitations, whether that's performance or repeated injury. And then we go into treatment, home program, and what's called gait retraining. And there's been some really exciting research. I mean, there's always really exciting research in running medicine, I think, but some really exciting research that came out primarily with Richard Willey and Irene Davis, where, for a long time we were functioning on a basis, if we strengthen people enough, they'll sift out their injuries, or their running will sift out, and they won't injure themselves anymore. And it was a slightly invalid thought process, because what they found is they would take runners and they would do these really great video analysis on the instrument treadmill and have all this data, and they would do really good strengthening with these people, so they'd make their glutes stronger and their glute max, glute med, hamstrings, core, so they would test them, they knew they were getting them stronger, and they put them back on the treadmill, and their running movements were the exact same. And they also correlated them with loading rates. Okay, so a lot of loading rates have been correlated with injuries. So they're running and properly loading just the same, and they're actually having the same pain. So they found that strengthening alone just wasn't enough as much of a stimulus as doing what we call gait retraining, and that's giving somebody a really strong cue to make one general change to their running movement to decrease the loading forces on whatever part of the gait cycle we deem appropriate after the video analysis. So gait retraining sometimes is appropriate and sometimes it's not, because what we'll find, and I tell people that, I'm like, I have no idea actually what we'll find until we're about an hour into this. Some people, they just have a few strength deficits and their running form is super efficient. Okay, so there's nothing external going on that we really need to fool with. It's more of an internal issue. Some people internally, they're super sound. Running form is the issue. And sometimes it's just one or two factors from both. So we put together those, and for everyone, it's very individual. And that's, I think, what makes it so much fun is probably an interesting word, but more rewarding to work with everybody, because everyone is so different. And they just bring a different set of, factors to the table. And once we sift them out, they usually do really well. So, yeah. Does that answer?
Yeah. Also answered my next question about what causes most running injuries. But if you want to touch on anything else that you might think of, but it sounds like we touched a lot on it in that last question. But is there anything else you would add to that?
Yeah. What causes most running injuries? Yeah, it's very different. The combination of things is very different individually. Overall, I probably should mention this too. So when I started doing video analysis, and this was in 2001. So this was, when was Born to Run? That was published in 2009. Is that right?
Around that time.
Yeah. So I did video analysis with people where I'd have them get on the treadmill, walk in shoes, walk barefoot, run barefoot, run with shoes. And I was doing a lot of video of their lower extremity kinematics, or their joint angles, because at that time I was also fabricating a lot of orthotics. And I also was looking at shoes. And so I wanted to see what people's feet were doing outside of their shoes, so because I couldn't see through their shoes. I just wanted to see what their feet were doing and then look at them in shoes. And I did this for years, and it was very common. I would see completely different kinematics when I would have somebody barefoot and somebody in shoes. Now at the time that seems, there's been so much research now, but I had, all this video, and when I see clients, they sign off if I can, share their video, of different parts for educational courses and things like that. So we had, Born to Run in 2009, and the whole barefoot movement and minimalist movement kind of started there. And then all the research kind of followed with that with Daniel Lieberman. And we kind of found there were a lot of different aspects from people, which makes sense, of course, when you run without shoes and you run with shoes. And I had all this video, so I could show people when I would teach classes. I used to teach a class on biomechanics through a seminar company. So I teach all over the country, a 2-day course on biomechanics for health professionals. And I had all this great video to show them when we were looking at this research. I'm like, so you see what someone does when their shoes are off and when their shoes are on. And it was great because I didn't know exactly what I was filming at the time. I just had it, and neither did the client. So it was really interesting seeing some of those things. But one of the products, I think, of our society in general, and it's no one's fault. We're in shoes. We're usually on man-made surfaces, but we do have a lot of overstriding in our country in general, and we also have a little bit sometimes interference with efficient cadence. And I think these things have gotten a lot of press. I think you had asked me, and I had a client recently that was asking me, there's so much stuff out there on YouTube and the internet about what to do about all this stuff. But I would say that, a lot of times what we're looking at are issues with cadence and overstriding. And if you ever want to look, scientifically at what the heart of that really is, Brian Heiderscheit did the landmark study a couple of years ago, looking at cadence and what happens when you start bringing someone's cadence towards what we call this more efficient kind of point of 180 steps per minute. If you look at a bell curve, we kind of put that 180 kind of at the top of the bell curve. So if someone's lower on that bell curve, if someone's 150, 160 steps per minute, what kind of changes do you see in people, in most people, when you start bringing them towards that 100, 180 mark? It doesn't mean that everyone needs to be at 180 at all. But we found that people tend to gear more towards a more efficient strike pattern, and it has nothing to do with the foot. I think there's a lot of research or a lot of buzz about, you should be a forefoot striker, you should be a rear foot striker. What we're talking about is actually making the foot land closer to the center of mass. So we have the knee is at a more flexed angle, and the foot is making contact initially closer to the body. Okay, that's the most important thing. And so I'd say overall, that's a really good cue. If somebody feels like they're having impact issues, that's the first thing to kind of look at. What is their general cadence? And are they overstriding it? Do they tend to land with a really straight knee and with the foot away from their body? So those are the two biggest reasons I think in running form that you'll see for the general population. And you can say it's like kind of a general statement. There's nothing that's going to be less efficient if you start bringing the foot underneath the body more, if you're overstriding. So.
Do you mind going down the shoe and insole rabbit hole for a second?
Yeah, sure. Yeah, sure.
Okay. That's near and dear to my heart. Now there's certain brands out there. We won't make mention of brand names right now, but they will tell you and have you believing that their insole should be in every shoe you own. Now, as our philosophy, with shoe fitting from our shop is not everybody needs an insole. And what is research showing right now? What do you see? Is it needed? Is it necessary? Does it have a place? And if so, what is that place?
Yeah. And actually there's been really good research in this realm. And I used to have to address it a lot because obviously if I was teaching, 50 people and biomechanics from all different places and they want to go back and treat their clients, that was a really pressing issue. So I did a lot of lit review about that subject. And I will say this, there is always continual research coming out that's generated. So I would say every 2 to 5 years, you're going to find a really good body of work that may be evolving, from this. So everything I say today may be different than what I said 5 years ago and may be different from 5 years from today. But it's all really exciting. And we have some great people doing a lot of this research, and it's wonderful. Like maximalist shoes, there's now, I think you're going to see a lot more research about the maximalist shoes, is what they call, shoes with more, soles for the minimalist shoes. Yeah. So the general thing about inserts. So you can have molded orthotics, right? So we take someone's custom foot mold and we make a custom footbed for them. So that's what we call molded orthotics. And I'm not talking about pathological population. So that's where someone's actually having a foot injury or a foot deformity. So that's kind of a different category. So we'll kind of put that away. We're talking about, a healthy population.
Yeah. Everyday runner.
Yeah, we'll talk about a healthy population. So, they look at molded orthotics and over-the-counter orthotics and different amounts of posting and things like that. And in general, the better research papers are finding there's really not a lot of difference between the custom molded and the over-the-counter. Okay, and what they're looking at is loading rates. So how fast are the tissues being loaded, and how do people respond, kinematically to some of these things. And they found kinematically, which is really interesting. So that's the actual degrees of movement of the heel, is that it really isn't that different, especially, and I'm talking about runners, okay, specifically running populations. 1 to 3 degrees difference at times with some of that. So kinematically, they're not finding a lot of difference, and energetically, there is a little bit of a difference with and without insoles in general. So they do find that insoles do decrease what we call the loading rate of soft tissues. And what that means is from the time that you first make contact with the ground to the time that your entire body mass has landed on that leg, so you fully descended upon that leg during your stance time, that the rate, if it's a little bit slower, that's a little bit less injurious, because you're loading your tissues more gradually. Okay, so a lower loading rate is deemed healthier or less injurious. That insoles do tend to decrease loading rates initially. Okay, so there's no research that backs up you should have an insole to prevent injury. They still haven't gone to that point, that they're preventative. But there is research when you look at patellofemoral pain and some lower leg injuries that temporarily you can use that as a buffer, because insoles do tend to decrease those loading rates of soft tissue. So you can use that Achilles tendinopathy and things like that. You can use that to decrease the loading rate while you're working on other things like gait retraining, like strengthening. And this is how, when we look at all the research, how do we communicate this to our clients? And a lot of this is also work with from like Irene Davis and Daniel Lieberman, but we can use them as temporary aids when we're trying to get people out of a painful episode, okay? So if we're someone has a flared up knee, okay? I'm gonna work on their gait mechanics if that's something that needs to be worked on. Now strength, we know it takes a couple weeks for strength, right? For true hypertrophy, 10 to 12 weeks for true muscle hypertrophy. So we know that doesn't kick in immediately, okay? We know strength gains will help, but we know it doesn't kick in immediately. We do know gait retraining helps. It's a little bit quicker, but it takes about 8 training sessions for them to ingrain that movement pattern. So we can use insoles if we do believe loading rate is something that we want to affect to decrease those symptoms initially. We can use that. And I tell clients, if this is successful, they're comfortable, they feel good, and they're successful, this is something where we can keep, I would strongly agree to keeping in the short term until you're out of the woods with this injury. And then you can work on either weaning out of that, to no insert of all, or you can keep them, that's fine. So we kind of leave it in that realm, but we're still giving them strengthening for those issues, so they're not developing, weakness or bad habits or things like that.
Okay. A lot of people that come into our shop, they come in asking for an insole because they want more arch support. So it's kind of a twofold question here. Do they provide arch support? Well, I guess 3. Is that arch support necessary if you already have a shoe, which is in itself an orthotic device? And I guess 3, does it inhibit the arch or weaken the arch in any way if you are adding the structure below your foot?
Yeah, so pronation, and this was, just from decades ago, pronation has always been kind of demonified because, you shouldn't have fallen arches and flat feet, and I think there was a lot of that, that's always in people's minds because of that ideology that's been from way back. So ideally, we don't need shoes at all, but we do, keep our feet, protected from surfaces and things like that. But there's definitely cultures that don't wear shoes at all. There's 4 layers of muscles on the bottom of the feet. And I think we're slowly moving into a place with shoe wear where we can actually start to strengthen our feet a little bit by diversifying the shoe wear that we have on a daily basis. We can talk about that a little bit, but yeah, it can, because we don't have to use those aspects of our pronation and supination to go through our gait cycle, so it does buffer that a little bit. And really the biggest thing that they find is they call it almost like a pseudo neuropathy, where we can't really feel our feet. So I mean, that's honestly why I think we have a lot of overstriding. It's because you can't feel your feet. I do it the same. You put a big cushy shoe on me, I cannot, because I do demonstrate aggressive heel striking or overstriding with clients. I can't feel a thing. But when I try to do things and show them things without my shoes on, there's no way I'm going to do that because it hurts. I mean, it's horribly painful. I'm not a 4-foot striker, but I have to when I have my shoes off. So we work very differently. There's really good research that doing a couple passes just to warm up, like in grass, either barefoot or in soft feet, was enough to increase intrinsic muscles of the foot. So you can do some really good things outside of your shoe wear. So you can keep developing your foot musculature. I wouldn't say someone, because they have orthotics, they're going to greatly decrease the strength of their feet overall, or it's going to be detrimental. I just think we should always have, especially in a healthy person or a healthy population, have that in our forefront of our minds. How can we work? I was going to bring this up a little bit later on. How can we work to strengthen those muscles of our feet with our everyday life? And there's some things that we can do with that. So I think really encouraging people to vary their footwear a lot through the week is helpful, and maybe have one day where they have a minimalist shoe that, again, this is not symptomatic patients. They don't have deformities. We're not talking about that, but where they have a minimalist shoe where they really feel like they, can use their foot a little bit during that day. So just varying, I think the footwear is important in healthy populations.
2 questions that spurred off that. The first, you've mentioned Jay DeSherry a few times thus far, and you turned me on to Jay, and I can't thank you enough for for that. He's been a great wealth of knowledge and resource, and has taught me a lot. He just recently wrote an article for Ultra Running Magazine in the importance of foot strength, and I'll try to link that in the show notes if I can, because it's a fantastic article on just, the importance of foot strength. Are there certain things that you would recommend that people do, not necessarily on a daily basis, but something they, include in their weekly routine, something, quick and easy that they can do, maybe just while they're brushing their teeth, that would, focus a little bit on foot strengthening?
Yeah, I think a really easy one, and a lot of people don't have their shoes on when they're brushing their teeth. You would just wake up in the morning and go and brush your teeth. I think a really good one and very simple is brushing your teeth balancing on one foot. Where we're supposed to brush our teeth for 2 minutes. Is that the journal recommendation? So I tell people, if you can balance on one leg while you brush your teeth, split it up between the legs, or while you're, cooking or whipping eggs or whatever, practice just balancing. It's a really easy thing to do. Because I think the more simple you make it, the better. I really like a lot of the acupressure mats, finding one that's comfortable for you and throwing it into your shower. So you can actually start to let the foot kind of splay a little bit and have some soft tissue release. Our feet get very tight.
That would be the needly mats.
Yeah. And there's lots of different types. I have one in the office that's more bulby, so it's very tolerable to people. I mean, you can definitely get some that are more spiky, and they're just, you just have to go to that different Zen place to stand on it. But there's definitely some that are more like just nutty and relaxed. So they almost look like river pebbles. So just find something that's comfortable for you. But I think massaging your feet, I think people can relax a little bit more in the shower and do stuff like that, but or have it by your sink. But I'm going to continue just to refer to that Running Rewired book by Jay DeSherry, because one, especially for listeners, like, it's just great if you just have one resource or one thing to kind of go to that it's going to be a staple. He has some great foot mobility and foot strengthening exercises in there, and he has a product. You have it, I think, the Mobo board.
I do.
Yeah. Mm-hmm. So I would say no matter what, I mean, the book is amazing. It's got really great strengthening techniques. You can do as little or as much as you want. You can do all this stuff at home with some simple equipment. But balancing on one leg while you brush your teeth, and doing, if you can, I mean, I think this is great, doing single leg heel raises and controlling the lowering up and down a couple times through your day is super important. Eccentrically loading that tendon, especially for runners, I think is a really important thing to do. Mm-hmm.
The article also talks about the mobile board, has a picture board in the article, and I've been using it. Keegan's been using it to re-strengthen his foot. He's just gone through plantar fasciitis and severs, so he did his first run yesterday. Thankfully, he's no pain, so super stoked to have him back running. But yes, the mobile board, I love that. And I also recommend while brushing your teeth, kind of stand on one leg. I think that's a great exercise. And we, as I said, kind of talking about the calf raises, doing those, I think that's super important. The other part of that question I wanted to talk about was in footwear. Not necessarily the maximalist. I think we can have a whole another conversation sometime about footwear. But a lot of times we get stuck with a brand. We get brand loyal, and we run in specifically that brand. That brand may only have, let's say, one ramp style where, like, for instance, Ultra, you're going to be zero drop no matter what. That's what they believe, and that's what they stick to. You kind of talked about how with footwear you can have different levels of cushioning. Should we also have different levels of ramp as well to kind of work different muscles and kind of stretch out the Achilles and let it rest at the same time on other days?
Yeah, so there's I think I put out a little YouTube when the quarantine started, because like everybody, like, well, let's just run a lot more. And so I was like, okay, there's a couple of really great things that we should keep in mind since we have all this time to run now. The weather was beautiful. But one of them it's a really exciting study because, one thing is really true, and I think I did a recently review, is a statement is in all the years and all this technology in shoes, when they do these systematic reviews and look at the percentage of running injuries, they really haven't gone down. You know what I'm saying? So it's really interesting. So running related injuries really haven't changed percentage wise over time, as shoe wear has developed. But there was a really exciting study that showed that people mix up their shoes. So if they have, 3 styles of running shoes, and it wasn't anything particular, but 3 styles of running shoes that they they call them parallel rotation, so they would equally exchange them out. It was almost a 39% reduction in injury, and that is huge when you're looking at, you don't see a lot of these changes in general, and so ramp differential. I mean, it's really hard nowadays, I think, to really find the traditional 12 millimeter ramp shoe. So some have 8, some have 4. And it's finding what's most comfortable for you. But and going back to the barefoot running, and we were talking about, there used to be like, how do you start integrating minimalist shoe wear and things like this. I think if you're going to start looking at rotating your shoes, and I don't think it matters with the cushioning, or like you have to go out of your way to get a ramp shoe if you run comfortably in ultras. I think just having a different brand is fine, because they will function a little bit differently. But if you do want to work also on your foot musculature a little bit, they say take 10% of your weekly mileage, and you can do a shoe. So if you run, let's say you run in I'll make this comparison. So if you run in a shoe that has 10 millimeters of sole underneath it, for 10% of your running weekly mileage, maybe taking a shoe that has 4 millimeters of sole and doing that little bit of mileage, so maybe a little recovery run or something like in that shoe. If you don't already have symptoms or an injury to the foot, like foot pain, it's a really great way that's been advocated in research to start building your foot musculature and running in what is neutral, a minimalist for you, and a little bit of your mileage. So if you're going to do that parallel rotation, I think that's a really nice thing to add if you have a healthy system. So like I have these old Merrells that have this, the little Vibram, what are those things called? They're really minimalist. But I won't do more than 2 or 3 miles in them. But I don't have any foot pain either. But I like to do that just to work my feet a little bit. And I also do it with my work shoes. Mm-hmm.
You're talking 4 millimeters total of cushioning in the shoe, right? We're not talking the ramp. We're just talking the actual.
No. Just in general. Yeah. So if you did want, if you're worried about developing your foot muscles with different running shoe wear, if you run in something that has a lot more cushioning, 10 millimeters would maybe be your minimalist shoe, so something that feels light to you. But just doing 10% of your weekly mileage in it, very little. But yeah, just rotating your shoes in parallel. But I wouldn't go out of your way to get a much higher ramp than what you're used to just to vary the shoe. Yeah.
Right on. So you have mentioned your YouTubes, which, I love your videos. Do you want to just, I'll put it in the show notes, but what's your YouTube channel? What's it?
Oh, the runner's mechanic. The runner's mechanic. Yeah.
Okay. I'll link that in the show notes. But my next question comes from YouTube and Facebook. There's so many self-corrected drills that are on the web right now. Can these resources suffice for people, or do you think they could do more harm than good if people like solely rely on them without seeking professional guidance?
Yeah, I mean, there's just so much out there. So I probably couldn't speak to what YouTubes are out there that would be injurious, just because there's just so much out there, and I'm really bad about just surfing around and kind of seeing what all is out there. I can give you some really reputable ones. So Chris Johnson, he's an amazing therapist and coach. He has a YouTube. Everything on his YouTube is gold. I mean, just absolutely great. Definitely can trust that. A lot of people like Kelly Starrett. I don't, he does the supple leopard and all that kind of stuff, and it's really good stuff. I don't watch a whole lot of his stuff, but a lot of people do like it. But Chris's drills are really good. So, I mean, I think you can do those really safely. And a lot of people, I think, would even think like, oh gosh, they're easy, but you try doing those and they're hard. They're hard. I mean, it's, it really gives you appreciation for those movements that you need to be good at. So,
right. But in terms of self-correction, like if we're looking to do the self-correction of our form and stuff, it probably behoove us more to do that with somebody that can look at you from the outside perspective rather than, yourself trying to even video yourself and trying to self-correct. That's kind of what I was going at. Using online stuff. The only two things I feel pretty sound with as general advice is decreasing aspects of overstriding and looking at cadence. And there's very specific ways to do that. So I still wouldn't just go off and do that without talking to somebody that knows, what they're doing. Because there's a lot of misinformation out there. And I think there's so many philosophies that push certain very rigid aspects that don't apply to everybody. I wouldn't go on YouTube and change form just because of the YouTube necessarily of what it's saying and thinking it's right for you. It might not be wrong. But if someone starts having pain, it doesn't feel right, or they start running into problems, I definitely would consult somebody that deals more with the biomechanics of runners. Yeah. What are some good things that we can take from YouTube? Things that we can incorporate into our daily routine that might benefit us in flexibility, strength, your mobility. There's certain things that you would incorporate just in general. It doesn't necessarily have to be a specific video, but for instance, like an active warm up, that kind of thing. Would you incorporate that kind of stuff into your daily routine? Is that something you suggest for runners?
So incorporating a warm up before they run, is that where you're at?
Yeah, just general things. That was just an example. But stuff along that line, or is that something you would suggest, or anything else?
Yeah, I think a warm up is a really good idea. I mean, you'll see a lot of different takes on, shouldn't warm up at all, and or you shouldn't do this at all. But yes, warming up is really important before you perform. How much of a warm up, you don't want to overdo it, depending on again what your performance is, and there's a couple of different reasons for that. But yeah, doing a good warm up, doing some drills. So running, the reason that it's interesting because you have all these different ideas about what you should do, because running is so different than what we do at any other points during our day because it's an elastic activity. Okay, the way that we get energy to run is we load our tendons, and the tendons recoil to actually move us forward. Okay, it's a bounding activity. So the energetics of it's completely reversed from walking or hiking or doing yard work. It's an elastic activity, and so you have to prep that elastic system before you run. And that's really why I think the biggest things that runners can do, so a little bit of warm up before you run, and some drills to, I think just the ABC skips or just something really, really easy is a great way to kind of prep that system. Doing a nice cool down, lifting once a week at least. If you don't lift at all, doing a basic lifting program, squats, deadlift, push press. If you're going to start with something super simple, because that is going to help work on the tendon system, okay, and prep that tendon system. Muscles help buffer some of the injuries for tendons. And I've always been really fascinated with tendinopathies. I'm taking actually another online course right now on tendinopathies, and it's because it's been, I think, one of those kind of mystical areas for science in general. And I think they're really dialing into what can we do for some of these tendon issues. But, once you are mid to late 30s, that's when you really have to start putting some extra work into your tendon system, because the tendons start to change a little bit in their ability to recover. So we don't see a whole lot of real tendinopathies in younger people. Those are usually more bone stress injuries. But tendinopathies they kind of blow up as we start to get into our 30s and 40s and 50s. And so I would say, especially for healthy populations, always working on those tendon systems is really important. Yeah.
And so, I mean, kind of one of the other great debates has always been the dynamic versus static, for warming up. And would you just kind of touch on, what the difference is, and B, which you prefer, and if there's a preferred time for either or the other, is there a place for both, or, are we kind of outdated in one thought, or, whatever you're currently thinking?
Yeah. I think always making it really simple. So static stretching is not recommended before performance. There's a couple of different reasons for that, but it tends, when they do the research, people statically stretch and then they have to perform. They don't perform as well as people that do dynamic warm-ups. Okay, and that makes sense, because we're not tapping into the elastic recoil neuromuscularly as much before we run, which we actually have to do when we run. So static stretching before you run is not recommended. Doing a light jog, okay, because again, that's kind of warming up the tendons with that elastic recoil. Doing some skips and just a few dynamic movements. So like on my website, I put, I think I have 3 dynamic warm-ups. And all it is controlling the tendons that go through a dynamic movement, just to kind of moving through that range, prepping your system. But it's just a little bit, okay, before that performance. So that's what I would recommend before you run. After you run, I think cooling down is a really good idea. You'll hear a lot of things about static stretching, and I think a lot of people are quick to kind of throw something completely away. I think having some mobility to your system is a good thing. So if you want to statically stretch after your performance, I think that's great. Hip flexors are chronically tight in our country. Hamstrings can get obviously overworked and a little bit tight, but just some gentle stretching. It doesn't have to be, you don't want to have an intense feeling or really, go after it too much, but just doing some gentle, long, 60 to 120 seconds of stretching for those muscles is great. So,
cool. Great. Is there a point where we work flexibility too much, especially as distance runners? Because you've always kind of told me that we need to be a little bit tight, because that's kind of how our muscles work, is, we need that tension in the muscle to be able to keep running long. Whereas if we have too flexible muscle, it's, not as optimal for a distance runner.
Yeah, the spring system. Exactly. And everyone has a little bit of a different collagen makeup. So once in a while I do get people that they're just naturally very flexible. Their collagen's very flexible. They're very flexible. And we work to really actually tighten their spring system. People that have a really tight, genetically tight collagen system, and they're already naturally good springs, they're usually really good athletes because they do have that kind of tightened spring system. So I do think a little bit of, just gentle stretching or yoga, that's great to integrate into things. Believe it or not, the one thing that actually can make us more mobile, and it seems counterintuitive, is lifting. It sounds a little bit crazy, but and I started doing some of these Zoom meetings during the quarantine. I had Kelly on just to give some people some basic. She made a Google Doc with some lifting techniques. But going through those lifting motions, so bringing the joints through that range under a little bit of load actually helps with mobility. And actually eccentric strengthening actually has really good validity in the research for increasing muscle mobility. So I think when you start tapping into the neuromuscular system, you actually can get really good functional mobility of those systems. So functionally, I think that matters the most. Okay, so I would say before you run, dynamic things, skips, dynamic warm-ups, and then having lifting, ideally for runners, people that are running like 2 times a week would be great. Not long, 30, 40 minutes. It doesn't have to be a big session, but it really helps.
What's like some examples of eccentric lifting movement?
Yeah, so eccentric means slowing down a motion. Okay, so, and it's actually really important for our tendons. So the major tendons for runners that are the Achilles, the hamstring, and the patella tendons. Okay, so for the Achilles, just getting a little bit of a weighted backpack, that's the easiest thing to do. Getting on a step, going up on both toes, pulling one leg up so you're just on one leg, and slowly descending for a count of 3, that heel down. That's an eccentric motion that's slowly lengthening the tendon under load. So that's really what you're doing. You're lengthening a tendon under load. So for the Achilles, that's slow heel drops off a step. I think people are pretty familiar with that. For the hamstring, that's usually like an RDL, like a Russian deadlift. You can do bilateral legs. You can do both legs. You can do single legs. These are in Running Rewired, which I also will go back to because they have great graphics in there, and I love because I know if people look at that, they're going to do it correctly. That's a really good one. And then you can also look at single leg squat. So really working on when you like sometimes I'll have a chair behind somebody and they just work on slowly going down into a squat to sit on the chair. Either with both legs under weight or one leg with no weight. So those are some really easy ways to do that with good form.
Mm-hmm. We've talked a lot about injury, but we talked about it a little bit before. A lot of us we try to run through an injury because we have an event coming up that we don't want to miss. But at what point are we risking too much, or we're risking further injury? Is there some red flags that we should throw up and say, if we're experiencing this or this is happening, we should stop running, maybe look for an avenue of cross training, or just hold off for a while on movement, on exercise.
Yeah. I mean, that's a great question because I think we all have those runs where we go out and then out of the blue, like something happens. Like all of a sudden you never had a T-band problem and you start having this pain down the side of your leg and you're like, oh gosh, is it just a cramp? And you try to shake it out and, then it never happens again and all your runs are fine. So I think once in a while you do have these little hiccups or cramps and things like that. Or you have a really hard run and you just, feel you overdid it and you just feel kind of bad for a day or two. But when you have something come up, and so we kind of use a pain rating scale, 0 being no pain and 10 is obviously being severe pain. You come up and you have an area of the body that starts to have maybe a greater than 5 out of 10 pain, and you start to experience this. Either it makes you stop running and you haven't been able to complete a run, or you notice this on multiple runs. That's when you really, I would say, want to get it treated. And I think a lot of people are afraid that they're going to be taken out of running if they stop and address their symptoms. There's a really interesting article. I taught in Virginia, and one of the courses I did was on the mentality of runners. I always thought it was a really interesting thing because, again, the first thing I do with somebody is do a really long initial interview. I just want to hear all about everything. And there were some really great studies on the mentality of runners, and they this was a Scandinavian study, and they took a group of really great runners, really good runners, and of course this is all being translated, but they said, what do you do when you have to stop running? And they kind of made it into 2 categories, and one was illness and one was injury. Okay. And all the runners reported when they start to have an illness, run a fever, felt horrible, they take their training down, they take care of themselves, get a little bit of rest, get over their cold a little bit, and get back to it. Okay. I said, great. So what do you do when you have an injury, like a pain, a physical pain? And it differed. If it was something they were familiar with, if it was like, say they had sprained their ankle before a couple times, they sprained their ankle again, they recognized it and they would take care of it. They would address it. They'd bring their training down just a little bit, address it, get it treated, and then get back up into their training. But they found if they did not recognize the pain, so if it was something completely new and it started to bother them, a lot of them kind of put it into this category where they ignored it. They didn't want to address it. And there was one woman, and they translated, she goes, I felt cowardly if I stopped to acknowledge this pain. So it was almost a fear mechanism that kind of tripped with most of these people. But they found eventually everyone that had that kind of fear behavior had to stop running altogether because the injury took them out. And then they had to, take much longer off to get back. So it's interesting. And it was just a mentality thing that actually interrupted people's training the most, to have that kind of that fear belief system. So if anything, know that if you acknowledge something that's going on and you get it addressed, it really is probably going to save you less time off your feet. Because, and especially with people that deal with runners, we have a lot of good research now. I rarely, and anyone that's come to see me, I don't tell people to stop running because the research doesn't support it unless I suspect a stress fracture. That's the one thing that I get people, especially if we call it a critical zone. Those are the few exceptions where I've got to get people off their feet and get them with the proper imaging. But for a lot of the soft tissue things, it's actually not encouraged. We change it a little bit and we modify things so that they can continue their fitness and they can continue to run on some kind of level. But we do continue that until they can get back to their normal training and they're not having that pain. So so if you start having something where it's stopping your runs, or you're acknowledging, on a scale from 0 to 10, you're like, oh, what is it? Like, I'm dealing with like a 7 on a, and it's been a little bit more than a week, I'm going to stop. Just know if you go to see somebody that deals with runners, they're probably not going to take you out of the game. They're probably going to rehab you, help you with some loading, help you with some strategies. There's really nice running protocols, and we give you some nice boundaries for your running so you can continue but not hurt yourself. So that's what we do. Does that make sense? Does that help?
Yeah. Oh, yeah. Great. Thank you.
Yeah. If you do have a fracture, if you do have a stress reaction or a stress fracture in a critical area, you want that identified. That is something that really can take people out for a long time if they run through it. And it can be a problem. It can lead to surgery. So, definitely get those looked at.
Thank you. If you were to create a toolkit for runners of devices to keep us strong, healthy, and mobile, what would it be?
Yeah, I thought that was a great question. I think a foam roller, and I think also, we're going to talk about some of the proven things for recovery, but a foam roller is great. And the good thing is everyone loves a foam roller. So your foam roller, I think also having a mobility ball that you like. There's so many different things out there, but when you find something that you like, I really like, and there's a little bit of research behind some of the percussion rollers and guns, and I think that's real trendy right now, is to have like the muscle percussion guns, like the Hypervolt or the Theragun, or the foam rollers that vibrate. They're great. They really are. So if that's something, you usually can try them in a store at your friends or something like that. But they're great things to have. But if you're just going to go, bargain basement time, the foam roller is a great thing to have. You can do a lot with it, and a little bit of like a lacrosse ball or mobility ball. And I think something heavy. So whether it's a medicine ball or a sandbag, or if you go down the road and buy a bar and some weights, I think having something heavy so you can do some of these loading activities, for your tendons, whether it's doing your strength training one day or doing some of the eccentrics for the tendons, having something heavy that you can use is important for loading. Yeah.
Cool. Anything so far as you would say you could use in place of buying something, some home remedies that we might be able to find around the house?
You're talking about for weights?
Yeah, weights. It's hard to find a massage tool that, aside from like using like a lacrosse ball, like you said, or something. But yeah, more on like the weight side of things.
Yeah, like trigger point stuff.
Yeah, well, if we were to do a weight session, but we couldn't get our hands on some kind of weighted devices, what are some things around the house that we could be creative with?
Oh yeah, definitely. So actually, there was a really nice Instagram by Will Fleming, but just getting a backpack, a rucksack, a backpack, whatever, and you can weight it easily. Whether it's you weigh out some books, you weigh out some sandbags, you make a sandbag. But yeah, you can making that your medicine ball is super easy. And you can do that. I really love if there really was any one lifting program that I love the most, it's the med ball program. So the med ball throws, the push press med ball throw is one of my favorites. I made 2 little workouts on my YouTube. One is an uphill strength training workout, and one's a downhill strength training workout that has a lot of eccentrics. But the uphill at the end of that, I put like 3 or 4 exercises, is the push press med ball. And in Jay Desheri's book, he has a whole med ball throwing program in there. I love it. It's super fun. It works the tendons. It loads the core. But yeah, I think loading, either a rucksack or a backpack with some sandbags. I mean, you can get 40 pounds, 50 pounds easy if you want to load it that heavy, or if you need to, or if you want to use 10, 20 pounds. But I think that's super easy. You can do it at home. You don't need to go out and buy really anything special, unless you want to get some stuff with the sandbags. But yeah, that's probably the easiest thing to do.
Cool.
Children, doing some push-ups with some children sitting on you.
Yeah. Yeah. Very on your shoulders. What's some things we could do at home right now? Aside if, obviously our forests we're closed. A lot of our trail running is going to be limited for a while. So aside from getting out on the road, what's some things we can do at home, to keep us fit and keep us sane?
Yeah. I mean, again, you can do a really nice lifting program with a weighted backpack, using that for your lifting. So you can do something basic, are you talking like for a strength program, you do your basic?
Cardio. I was thinking more like along the roads of cardio.
Cardio.
For instance. Yeah. Yeah. So is there, some, would you recommend like a jump rope routine, or, what other things can we do at home?
Yeah, so this is probably a great time to use the heart rate monitors, which actually I need to buy one. So the heart rate tracker is it's a great idea. But if you do have to do something that you're not familiar with other than running, and the idea is to get your heart rate up, you want to make sure that you can track that, obviously, because yeah, you could do a circuit of burpees and jump rope and push-ups, and just to get your heart rate up, so do that kind of more circuit training. You can make a little obstacle course if you want to be real inventive around your house. So I think it was the other day I have a really steep driveway. Okay. And I love it because I know I can use that driveway and do eccentric super easy. It's not hard because I'm at a 40-degree incline. And so I don't need a lot of weight, but I literally can do, and you don't need that many reps for eccentrics. That's kind of the nice thing too. But so I can use my driveway to as an extra load. So people can, but if you want to use it for cardio, you can, again, just practice running up those little shorts, those short hills, or, anything in your backyard. A lot of us do have those sharp inclines, but yeah, I would say anything to just keep your heart rate up in that zone, so you can get the cardio that you want. But you might have to be a little bit inventive if you want to do it for, a good amount of time, and not be on, some people have some home treadmills and things like that, but yeah, it makes it fun, and the weather's been so nice. I mean, that's one of the real blessings we've had is just this incredible weather, which, it's been keeping me sane. I hope it has other people, but it's really been a perk. So, but I think making an obstacle course is super fun if, especially if you have other people like in your household, kids and things like that. And just, it makes the time go by.
Absolutely. So are there any anything that you've found that you'd like to share with all of us that you see we typically do as runners that we probably shouldn't be doing? Any behaviors that you'd like to smack our hands for doing?
Oh gosh, the biggest thing, and I also am like a member of a lot of these professional pages where people that are way more advanced in coaching and things like that than I am, and just to make sure my thought process is right, but just making sure that you're recovering. I think that's a big thing, recovering from your heavy runs or your lifting sessions and things like that. So making, proper recovery, trying to make sleep a priority, taking really good care of yourself in that manner. I think those things are really important. So just being nice to yourself, I think, as an athlete, because I think we tend to like to beat ourselves up a bit. But I'm trying to think of anything really detrimental, that people do. But I think the biggest thing is just to be kind to yourself and really, your day that you're supposed to recover. And that's why I really believe in utilizing really good coaches, like yourself, you just to keep people on a good track. And with that, because it's hard to do. I think recovery is probably one of the hardest things to do sometimes.
Yeah, well, absolutely. Yeah. Absolutely. So along those lines, are there any specific recovery aids or therapies new to the market that are showing promise, or any to the contrary? So are you seeing anything? Sleep aids can just be nutritional. Could be any of the we've kind of talked about the Theraguns. You feel good about those, and the vibrating foam rollers and all that stuff. But anything you see out there right now that it's probably just wasting people's money, or anything that you're like, wow, this is a great product.
Yeah, so I did. I've heard some things, and I did a lit review, and in 2015 they did a systematic review. This was American College of Sports Medicine. And the nice thing is, the things that we've always really liked seem to hold some water. So compression garments, they had a pretty good level of evidence for helping delay DOMS, delayed onset muscle soreness, muscular strength, power. All those kinds of things. So compression garments tend to still hold water. Massage delays DOMS. Foam rolling massage improves DOMS and jump performance. So we still, I can still stand behind that really well, and it feels really good. So luckily those are good. And again, this isn't really an option right now, but the cryotherapy is like the full body cryotherapy, and if they found maybe an effective method of improving recovery from strenuous exercise, it was kind of held a maybe there. Cold water immersion, slightly beneficial for reducing DOMS and recovery of sprint speed. But and those are all, those are all really good things to do, and they're not expensive, and I think I could stand behind those things. Is there anything that you see that you're wondering about in particular?
No. We kind of talked about some of the nutritional things in the last podcast, recovery and stuff like that.
Yeah, I didn't get to. I listened to. Tell me what they said on that, because I do have some stuff on nutrition here.
Yeah, so we talked about having protein before bedtime. Mm-hmm. So Jake talked about how much protein we should be eating or even drinking even before bed. Like we talked a little bit about magnesium, because that was one of the things I had heard was potentially something good before bed, and he had kind of said that he could see where it might be beneficial. He wasn't sure if it would really have effects on your sleep or the quality of your sleep, because it is a relaxer, so it's supposed to help you relax. So he could see where it would be potentially good to make you fall asleep, but beyond that, he wasn't sure. And we didn't really get into the CBD talk too much. Have you been recommending CBD for other aspects as well, like as a topical or anything like that? Do you see any benefits in the CBD market right now?
Yeah, I don't do any nutritional recommendations, and CBD is so, I talk to some of the physicians I see about it. There's just not a lot of, good evidence research out there about what it does, and it doesn't seem to actually be as regulated also. I don't know if one CBD product, we don't really know what that is like compared to another CBD product. So I think the general consensus when I talk to my physicians is if it seems to help somebody, great. If it doesn't do anything, it doesn't do anything.
Right.
So, and I think anecdotally, my clients that use it, it's still across the board. Some feel it really helps them sleep. Some feel it doesn't do anything, or that kind of thing. So, but here, when I was looking at the systematic review, there is a little bit about nutritional. So if there's more than a 24 hours between bouts of exercise, foods with higher glycemic index are beneficial. That was a level 1 evidence study. So that was something that they found. And then earlier calorie replacement is also beneficial. So those were two with nutrition that they found having good evidence.
Great.
So
thanks. So we've mentioned Running Rewired by Jay Sherry a number of times. That's probably one of yours and mine top books to recommend to people, and rightly so. It is a great book and a great resource. Is there anything else that you might suggest runners buy or have in their library that they can refer to?
Gosh. Let me think about that. There is a lot out there. There's a lot of, podcasts, I think. As far as books, I'm not quite sure if there's a book that, and that's part of me. There probably are some great books out there, but clinically, that's the one I really think gives some very simple, good tools for people. But yeah, I can't really think of anything right now as far as books.
Yeah, well, it's such a wealth of resource, Running Rewired. So, it just shows how good that book is. We had a listener question, which was about sleeping position. Is there any position that's you shouldn't sleep in, or any position that's better than another for sleeping?
Yeah. One thing I think to be aware of is after, a workout or a run, and this can happen, is if you lie on your side, and especially for the females, we tend to, our hips tend to be a little bit wider than our male counterparts. And as our knees rest together, it does place the IT band in a little bit of stress. And so if someone is dealing with some IT band tightness, or something like that, trying at least start out with a pillow or two between your knees will help decrease the height differential between the hip and the knee and side-lying positions. So that is helpful. Unfortunately, there's not a lot we can do to control our sleep positions. As much as people kind of start out in one position, I think mostly they end up in the position that they're most comfortable with, or throwing out their pillow or whatever. But that is a nice, especially if that's something you're starting to notice is tightness in your IT bands after a run. If you can't start out with a pillow between the knees, that is helpful. Mm-hmm.
Great.
Yeah.
All right. So we're kind of winding down here. Is there anything, if you had one golden nugget to offer to runners and our listeners, what golden nugget would you offer for them?
Yeah. So I think when you're a runner, you always want to think about every aspect of your life. How can I better my system for the run? Okay. Because again, it's such a different event than anything else we do during our daily life. And maybe someone's running 3 times a week, or, some people are running 7 days a week, but I think the biggest things to think about that help make that transition when you go into your run is, so I call it the postural C. So if you're sitting right now listening to this, if you just kind of generally look at your body and notice the C shape, being your front is the inside of this C shape. These are the muscles that generally tend to be tight, so our pecs, Our thoracic spine tends to be a little bit stiffer in our culture. Our hip flexors get a little bit tight. So just the end of the day, especially if you do have a foam roller, and I'm going to put out a little YouTube on this because you can do a little routine on a foam roller. It's so easy. It's like 5 minutes at the end of your day. It feels so good just to lay out on it. But stretching out your posture, opening up your pecs, stretching your thoracic spine. So anything that stretches anything out on that front part of that C, hip flexor mobility, however you like to do that, I'll give you some tools to do that in the little YouTube clip. But stretching your hip flexors, mobilizing your thoracic spine, stretching your pecs out, just basically opening up the entire front part of your body is, I think, something. If you don't have an ounce of energy at the end of the day, that's the one thing. Just lie on your foam roller and just open up those muscles a bit. Because that's really what we need as soon as we break into a run is we're just, we have to use that posterior chain. We have to open up our hips and our posture and get mobility in our thoracic spine. So that's pretty much the one thing I really like people to think about is how to reverse the effects of your day, especially if your day has some sitting involved, which we do. I mean, we drive to places and things like that. So, when people look at, so sometimes I give people a hip flexor stretch for about 3 minutes because their hip flexors are so tight, and 3 minutes feels like an eternity. But when was the last time you just took a 3-minute car ride? We keep our hip flexors shortened for minutes and hours on end, so we do have to do a little bit of this counter work to prep our system. So just thinking about opening up our posture, rotating our shoes, as we mentioned, that's the second one, and what we can do to keep our tendons healthy. And the biggest one, which you probably have your clients do, is keep a journal of what you're doing. I think keeping track of your training loads is super important, especially if someone considered it more of a hobby and then is getting into it more seriously, and they're not really taking into account how much ramping up they're doing, being aware of that, because that's something you have complete control over, but it's also one of the number one reasons for injuries is just ramping up too quickly or adding load too quickly or change too quickly. So, yeah.
Thank you. Anything else you want to add?
No, I really enjoyed this. Thank you so much. I really appreciate that.
I appreciate it. Yeah. Well, I'm sure we'll have more to talk about as everything seems to change so quickly anymore.
Yeah.
But
I know.
Thank you so much for your time, Miriam. And hopefully we'll be able to catch up sooner rather than later.
Yeah, that sounds good, Aaron. Thank you so much for having me. I really appreciate it.
Absolutely. You got it.